Hi, my name is Dr. Brian Cahan, and today I'm going to demonstrate doing a left L5 S1 medial branch block utilizing Stick-It-2-Me, a biodegradable interventional spinal training module. Stick-It-2-Me allows the interventionalist to continue to practice their technique without harming any patients and without having to utilize a cadaver. This is biodegradable, it's stored in your refrigerator, and can be used in your office with fluoroscopy to continue to practice and work on your interventional skills without harming patients. This is an excellent training module for residents as well as fellows to learn how to master the steerability of the spinal needle without actually harming any patients while they're doing it. This will demonstrate an left L5 S1 medial branch block, and I will show you how we do this. At the current time, under fluoroscopy, you will see that I have my S1 end plate lined up. We have our superior articular process on the left L5 region and the sacral ala. The medial branch nerve goes right in the notch in between the superior articular process and the juxtaposition with the ala. I will then oblique my view so that I can see the superior articular process and the area that we need to go to. Utilizing a pointer and fluoroscopy, our goal is to go right there. Once I have my skin marked out, I will insert my needle into the skin. I will then utilize fluoroscopy to advance my needle over the medial branch. Just like we do in patients, I utilize the curve of the needle and the curve of the bevel. Understand that the notch is on the side of the bevel, so your needle will actually move away from your notch. Currently, my notch is pointing sort of caudally as well as medially, and as you can see, the tip of the needle is going laterally. I will rotate that about 90 degrees, and this will put my notch out laterally and will cause my needle to go medial and superior, as you can see here. I will then keep directing it more medial as I advance it, and we will see that the hub of the needle will come over the needle tip as we advance deeper. We now are going to rotate it 180 degrees so that the notch is pointed towards me, and we'll direct the needle deeper into the patient. As you can see, we're working our way directly down to that notch, and we are curving and moving through our interventional model the same way we move through our patients as we advance the needle to the correct endpoint. We are then getting deeper into the patient and towards our notch. And at this current time, I don't want to dive any deeper, so I rotate the needle 180 degrees and we'll start going up superiorly. As you can see here, I will then rotate it 180 degrees and it will dive deeper. As you can see here, I am currently on bone, so I believe I have reached my endpoint, and I will now go to an AP view. As you can see in the AP view, we are slightly inferior of where we ultimately want to be. We have bone as our endpoint, and we will then rotate it 180 degrees, and I'm able to advance it a little bit more, and you will see that the needle rides up superiorly. And that's where we would inject our medial branch. We would inject about 1.5 cc of xylocaine, and then we will withdraw the needle. We can successfully do this over and over again to practice our needle steerability techniques, as well as becoming familiar with our spinal anatomy for fluoroscopic guidance, utilizing our interventional training model. At the end of the day, when we're finished with it, we put it back in the refrigerator for when we want to utilize it the next time.